Hi, it's Amy. Welcome back. So here's what we're going to talk about today. How do you work on your problems? Well, one at a time. Going through this process, you're going to continually discover new things about yourself. Some of it you might not like. I can guarantee you that a lot of it you might not like, and a lot of it is going to be really overwhelming. The first thing you're going to need to do is to start to practice open and honest disclosure. Sounds easy. It's not easy. If you've already committed a sexual crime, you'll need to be honest about your feelings that you had before, during, and after the offense. Again, especially if you're working with a therapist, you'll need to be open and honest, or there's really no point in being in therapy. Without transparency, you really have nothing. The other thing that you're going to need to do, especially if you're working with a therapist, is to actively participate. This whole process cannot be done half-assed. All right, and no one is going to do it for you. If you're sincere about changing your behavior, then you're going to have to participate in the process. You're going to have to be able to receive feedback if you're not doing this alone. You may have a way that you imagine yourself to be. I can guarantee you that it is not accurate. You'll have to be open to finding that out. You'll have to be open to people confronting you about what you've done. Not just in regard to your sexually abusive behavior, but in any other issue that you're working on. If you have drugs or alcohol as an issue, you'll have to be willing to take some confrontation from others. That doesn't mean that it has to be violent, and people don't have to be in your face, and you don't have to be in anybody's face, but you can't expect people to be happy about what you've done. The next thing you're going to need to do is learn. There are a lot of treatment tools available to you. You're going to have to learn about your thoughts and about your feelings and about your behaviors, etc., but they all have led you to sexually abusing someone. So you're going to have to examine all of these things. So you might be asking yourself, what tools are available to me? Well, there are a lot of them, and you're going to have to figure out what works best for you. But I can tell you that without a method or a system for treatment, it's going to fall apart. You have to have something in place if you're going to make change. Some kind of method, some kind of system, and we're going to talk about a few different methods of treatment or things that you can do during this process that will help you. The first thing is reading for understanding. You've got the whole big interwebs out there full of all kinds of articles and all kinds of information at your fingertips. Use it. There are all kinds of great books. You remember books, don't you? Those things you open with the pages in them, those papery things? Yes, there's all kinds of good books that you can learn from. There are workbooks that you can get yourself that have all kinds of exercises in them. There's a lot out there. There are written assignments, which is what I have been giving you here almost every day. Do them. It doesn't matter if you write well. I don't care if you can't spell. I'm not looking at your work. I'm not grading your papers. But the process is important. These assignments can really help you look at things a lot more objectively. All right, like I said before, having a plan. A plan. Write it out. Write out how you're going to act differently when you encounter the problems that you're having now. Okay? The way you've been doing things hasn't worked. You wouldn't be here if they had. It may take some more work before you actually have a plan that's complete, but start looking at how you've handled things in the past. Start examining that, and maybe even give yourself some kind of reward if you can go a week handling things differently. Figure out something nice that you can do for yourself if you go a whole week without getting angry or without having sexual fantasies that are harmful and abusive. When you stop yourself, which we'll get into how to do that later, but if you can start to work on that now, give yourself a reward at the end of the week if you are starting to make changes, but have a plan of some kind. Group therapy, which I highly recommend. This can be super, super helpful. As I said in the video, as helpful as I can be, or as I'm trying to be, or as well-meaning as your friends and family try to be, they haven't walked in your shoes. They don't really get how you're feeling, okay? But if you can go to a group where there are people there who do understand, who do have some of the same issues you do, it can really be very comforting and very helpful. You may go to a group and you might not even say anything the first time you're there or the second time you're there, but slowly you will learn to trust the people who are there and you'll begin to open up. You'll be able to do some of this hard work. I can tell you that, and I may have mentioned it in the first video, one of the things men leaving this program, when they had it in prison, we had individual therapy for them and group therapy. And one of the things they absolutely said they missed the most was group. There's also individual therapy that is available for you, even if cost is an issue. There are organizations, there are therapists who will do things on a sliding scale. Seek them out. There is behavioral rehearsal. Now, this is something that therapists can be particularly helpful with. They may help you or give you suggestions that are ways of coping when you have harmful or dangerous sexual thoughts and fantasies. They can give you ways of coping with that. We'll do some of that here, but therapists are also very good with behavioral rehearsal. There are education classes. That's what you're doing here with me right now. There may be more out there. You should feel free to look into some other options. There is also behavioral conditioning. That is also something we'll be covering here, but again, a therapist can assist you with this also. Most people who commit sexual crimes have fantasies about those crimes, and the fantasies intensify right before the crime is committed. There are techniques, some of which we will cover here, that can make these fantasies less pleasurable. And the last thing that we'll talk about today is medication. And this is something that only a medical doctor can prescribe for you, a psychiatrist or another medical doctor. They can prescribe these for you. Some medications like Depo-Provera are said to help control urges or fantasies. This is only a temporary method, and it is not a go-to move. You should not expect to just walk in a doctor's office and get that script. There are also meds for anxiety, which may be connected to the issues that you have. Again, I would not even begin to suggest medication myself, and no one else should. Only a practicing physician should ever be making any of these suggestions. Now, let's talk about an action plan. Think about all the methods that I just spoke about. Which do you think would work best for you? Obviously, it's going to take a combination of these things. How do you think that the methods that you will choose are going to be most helpful for you? Sometimes it helps to tell someone what you plan to do when you're making these changes in your life. This way it makes you accountable. Remember we talked about being accountable? So if you choose to work with a therapist, you can tell them what kind of changes you're making. But if you're not there yet, maybe you have a friend or a family member who you trust, and tell them about the amazing changes that you're making in your life. Next time, we're going to start talking about how you became a sex offender. Please subscribe to this channel. Feel free to leave comments and questions below or on our Facebook page or on Twitter. Same name as this channel. I'm really trying to make it easy for you. Or if you have questions, or privately send a message to me through Facebook or Twitter, you will feel more connected and not so alone. I think it's great that you're here to learn. I'm really proud of you. This is not easy, but it'll get easier. I promise. Until next time, be well.